Hi everyone, welcome to that platform. My name is Haman and I'm doing pharmacy and I'm in my last year. We are here to build life and we are here to build health. I want you to travel with me this journey up to the end. I want us to build a community, a very big community. I promised you in my last video that I'm going to be telling you the severe signs of menstruation and how we can go about them. Therefore, in this video, I have come to tell you about the severe signs of periods, and this time referred to as premenstrual syndrome. These signs are emotional. I don't want to overdefine the term, but these signs are emotional and they are physical, and they always come a few days before your periods, and they can even continue throughout your periods, but they can be severe. For example, if you were feeling cramps last time, the cramps can be severe if you have PMS, premenstrual syndrome. If you were feeling, for example, headaches, the headaches this time around, they can be severe. You can even refer to them as migraines, but they are not migraines. Okay, so in this video, that's what we're going to look at. By the way, the information in this platform is not biased, it's researched, and it's proven. Feeling the symptoms of periods, it's very normal, it's very normal, and anyone can get them. You can get them maybe always, you can get them once in a while. Some people don't even feel anything at all. Now let me take you through the physical symptoms that show you that you have premenstrual syndrome. When you overcrave, it's number one. If you overcrave for food, your appetite is increasingly high and it's constant, especially before your periods and even during your periods. It is a sign that you have premenstrual syndrome. Number two, if your cramps are really severe. Cramps can come, but if they are severe, they are too painful. You're feeling your stomach is too painful, your lower stomach is too painful. If you feel like your lower back is too painful and aching, then you can start suspecting that maybe you have premenstrual syndrome. Number two is when your breasts become tender. And on top of being tender, remember in the symptoms of periods, we were talking about tenderness of the breasts and soreness. By this time round, they even become swollen and they can be more painful. So if you experience such a symptom, you can refer, or you can start thinking that maybe you have premenstrual syndrome. Number four, one of the physical signs or symptoms that show that you have premenstrual syndrome is when your stomach is bloated. The stomach can be bloated, where you can feel like the stomach is puffy, when you feel like your stomach is too full, like as if you have gas inside your stomach and it's too much, you can refer to that. Maybe you have premenstrual syndrome. And another point is weight gain. At this moment, among the symptoms that we saw in the symptoms of having, or that your periods are coming, is exercise intolerance. And here, if now the symptoms are severe, it means that you cannot even do your exercises. I'm not relating to weight gain to exercises, because weight gain can also be related to the hormones you may be having. Maybe the hormones are too much in your body, but at least know that when you put on weight in that way, then there is a high chance that you have premenstrual syndrome. Another point is dizziness. If you always feel dizzy, as I've told you, days before your periods, a few days before your periods and during your periods, you are dizzy, you feel like you want to vomit, if you smell a thing, you want to vomit and all that, then you can try to think that you have premenstrual syndrome. Another thing is when you have headaches. Headaches can always be severe, and they can even come when your periods are there, or when your menses are normal, can always have these headaches, and they should not scare you. But when they are severe, then you should start suspecting that maybe you have premenstrual syndrome. Swelling of your hands or feet is another point. If your feet are swelling, I don't want to call it edema, but if your feet are swelling, your hands are swelling, then you try to suspect that something is wrong, especially if you know your periods. If you read your calendar and you know that at this time of the day my periods, I'm expecting my periods to come, then a few days before those days, if you start seeing like your fingers are swelling, your hands are swelling, like your feet are swelling like as if you're pregnant, then don't say that you're pregnant. You can try to visit a doctor, or you can try to take a pregnancy test, but I recommend that you visit a doctor. Another symptom that can show you that you have premenstrual syndrome is severe stomach upset. If your stomach is upset, feel like you want to have diarrhea, okay, if you can even have diarrhea when it's severe, your periods have you have premenstrual syndrome, or you might be having premenstrual syndrome. Don't rush for medicines, don't rush for medications. Medications are here to save lives, but it should not be daily food. Now, if you see that you have such symptoms, I recommend that you visit a doctor. Don't treat them from home. It's too risky. Go talk to a doctor. Government hospitals are there. You can go and talk to a doctor. They are free. They are free. Advice from a doctor is very, very important and very crucial. Other than treating from other than treating yourself from home, it is very risky. Now, those symptoms we have been talking about, they are physical symptoms, and we said we have both physical and emotional symptoms. Now let us go and look at the emotional symptoms, where I'm so much interested by that, because I study mental health, and I even have a platform where I help people with mental challenges. That platform is called Psyche to Go Yugi. Psyche to Go Yugi. So you can go and visit that platform. We build that platform. It's just there to help people with these mental challenges. Now, one of the most common mental emotional symptoms of premenstrual syndrome is depression. Depression, but you don't like, let me just say that you feel depressed, you feel sad, you lose interest in the things you always do. Yes, yeah. So when you start seeing that you are losing interest in the things you do, if you know the symptoms of depression, if you don't know the symptoms of depression, you can visit the other Psych to Go UG channel, and you'll know the symptoms of depression. Number 2, mood swings. When your moods are always on and off, you always love this, but now this one has gone, you feel anxious, today, right now you're happy, the next time you're not happy, then you should think, or you should start suspecting that you might be having premenstrual syndrome, especially if you have studied your cycle very well. Irritability. If you're very angry, always like something small sparks you off. Your kid has been playing in the chairs, and you've not been feeling anything, but right now your kid is playing in the chairs and he's jumping, they're playing, and you just back at them, okay, then start suspecting that maybe you have premenstrual syndrome. Another point is when you start crying suddenly, you should also suspect that, especially if you've started your menstrual cycle, you should start suspecting that maybe you might be having premenstrual syndrome. Then if you're unsocial, yet you've been in people and all that, but this time around you start feeling like you're unsocial, you don't socialize with other people, you don't go out to jazz with your friends, when they call you, you're just ignoring them, then when for you just want to be maybe alone, try to think about that point, that maybe you might be having premenstrual syndrome. And if you lose your sex drive, you should also suspect, because as I've told you last time that in the previous video, that it's among the signs of periods increase in your sex drive. But then when you lose it, then try to think in the other way around. Then if you lack concentration, you lose concentration in the things you do. If you are a student, you don't concentrate in your books. If you're at work, you don't concentrate at work, your mind is here and there. Then try to think in the other way, that maybe you have premenstrual syndrome, especially if you have studied your calendar very well. Then if you have sleep disturbances, you don't sleep well, it can also be a sign that maybe you have premenstrual syndrome. So those are the signs that can show you that you have premenstrual syndromes. I have given you 10 emotional symptoms and 9 physical symptoms. Now, these symptoms can happen to any person. They can happen to someone, or they may not happen to the other person, and they are normal. So you should not always be worried of this and that. Okay, so that's what I know. Now, when can you see a doctor? If you see these symptoms are severe, when they are lasting for about 3 months, like they come this month, they come the other month, and they come the other month consecutively, then you try to see your doctor. The problem might be bigger than that. Then if these symptoms begin 5 days before your periods, then try to see a doctor. Consider seeing a doctor. It's very, very important. I have told you that here we want to treat ourselves, but it's not always the case. We have doctors, whether they are few, whether they are many, go and visit a doctor. Your health matters a lot on this platform. Then if these symptoms interfere with your daily activities, also try to visit a doctor. And if you suspect that you have these symptoms, if you just think that these symptoms are there and you just suspect that maybe might be premenstrual syndrome, also try to see a doctor. Don't treat these symptoms at home. Another disclaimer I can give you is that you might be having PID, you might be having depression, you might be having anxiety, you might be having symptoms of menopause. Especially if you're in 40 years plus, around 40 years, you might be having symptoms of menopause. So you should not confuse the symptoms, okay? I will repeat them. Symptoms of menopause may present in the same way. Symptoms of anxiety, because anxiety is also another big problem. Depression is also another big problem. And if you have thyroid diseases is where your thyroid can be huge. It can enlarge. Maybe you have goiter, yeah. Or if you have a thyroid cancer, or if your thyroid is small, it's in the normal shape, but it is producing much more thyroid hormones, or if it is producing a few of the thyroid hormones, you might get these symptoms. Why? The thyroid gland, what most of us in Uganda think that it's goiter. It's not goiter. So you might be seeing someone with a swollen thyroid and you might say it's just goiter. It's not necessarily goiter. Someone can even have thyroid problems when their thyroid is just as normal as mine. You understand? So if the thyroid has a problem, you might get these very symptoms. The reason is because the thyroid controls almost all the activities of the body. The thyroid gland, like the thyroid hormone, controls almost all the activities in the body, from metabolism to excretion and all the other things, even your brain functioning. So if you see these symptoms, that's why I'm recommending that if you see these symptoms, don't rush to treat yourself, to use things that lower your abdominal cramps and all that, okay? Just go and see a doctor. Just if the pain is there, just relieve it, maybe with painkillers and simple painkillers. If maybe you have abdominal cramps, you can always do things I'm going to tell you in our coming video, so that we can just relieve the symptoms. But don't stay at home if you suspect that there is a problem. you go and visit your doctor. Thank you. See you in the next video. Bye.